Now it is time to answer some common medical questions, and joining us live is News Channel 5's medical specialist, Dr. David Soria. He's the Chief of Emergency Medicine at Wellington Regional Medical Center. Good afternoon.
Good afternoon. How are you?
I'm great.
Good.
Thank you for coming in. Our first question, a lot of folks wanting to get out there and work out, keep those summer bods in shape. So is it better to apply heat or cold to sore muscles after working out?
Yeah, well, I mean, here we are trying to do something good for ourselves, and you get sore. So, I mean, what that is, first of all, is, muscle soreness is basically the strain and stress on your muscles, and what happens is you get micro damage, which is small little tiny tears in the muscle. The micro damage then causes inflammation, which in turn then causes soreness. So, general rule, ice, then heat. What the ice does is two things. One is causes soothing and numbness to the area, relieves some of the pain, but also it vasoconstricts or tightens the blood vessels so that it decreases inflammation and the swelling. Then, about 36 to 48 hours later, that's when you can apply heat. And heat is beneficial for two reasons. It increases that blood flow, brings oxygen and nutrients to the area that's affected, but then also can clear some of the toxic mediators or inflammation out of the area and helps you heal the fastest.
I may have to do that tonight. I'm taking a boot camp class and I'm sore, very sore. All right, here's our second question. What's the best way to relieve heartburn? Yeah,
we hear a lot about many different methods, some from your doctor, some home remedies. A lot of times it's enough to cause heartburn. The reality is that there's two things you've got to remember. One is prevention, one is treatment. Prevention means avoiding some of the things that you may enjoy. Alcohol, tobacco, chocolate, spicy foods, fatty foods.
Doctor, no fun today.
This is what I mean. It's not fun preventing heartburn. You many times should not eat 3 hours before you lie down. And if you're having some of the symptoms at night, make sure you raise or prop yourself up about 30 degrees and let gravity take effect. Those are the things that are going to prevent acid production in the stomach. Now, treatment means decreasing the amount of acid in your stomach and allowing the mucosal lining of your stomach to heal. There's medicines for that. One is antacids. We all know those over the counter. That helps neutralize the acids in your stomach. The second is going to be something called H2 blockers, which are Pepcid, Zantac, things over the counter. Those are mild medicines that help reduce the production of acid in the stomach. And then there's today's most state-of-the-art ones, and those are called proton pump inhibitors, Prilosec, Protonix, medicines like that. Powerful, decrease the production. Work very well, but you got to get a prescription for those. But if you're having symptoms to that extent, make sure you go see your doctor, please.
Well, good to know we can have some relief if we overindulge at all those holiday parties.
I see it coming.
Well, folks, if you have a question for Dr. Soria, you can send it in by going to our website, WPTV.com, and clicking on the health link, and then scroll down on the right-hand side, and that's where you'll see a form to write in your question. Thank you so much for coming in. Always great to see you.
You too, Phil.
Looking dashing in that paisley tie. We'll see you next week, and we'll see you after the break.